Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
A client has been in the critical care unit for 3 days following a severe myocardial infarction. Although he is medically stable, he has begun to have fluctuating episodes of consciousness, illogical thinking, and anxiety. He is picking at the air to catch these baby angels fly around my head. While waiting for medical and psychiatric consults, the nurse must intervene with the client's needs. Which of the following needs have the highest priority? Select all that apply. 1. Decreasing as much foreign stimuli as possible. 2. Avoiding challenging the client's perceptions about baby angels. 3. Orienting the client about his medical condition. 4. Gently presenting reality as needed. 5. Calling the client's family to report his onset of dementia. The correct answers are 1, 2, and 4. The abnormal stimuli of the critical care unit can aggravate the symptoms of delirium. Arguing with hallucinations is inappropriate when a client has illogical thinking. Gently presenting reality is appropriate. Dementia is not the likely cause of the client's symptoms. The client is experiencing delirium, not dementia. A 23-year-old client diagnosed with schizophrenia cheerfully announces, "My mom and I are so excited that I'm pregnant. She's willing to help us take care of the baby too." Which of the following reasons should cause the nurse to be concerned about the situation? 1. The client did not say that the father of the baby was excited about this. 2. The mother is not likely to provide enough help for what the client needs. 3. Symptom management will be difficult in early pregnancy without medications. 4. The client will have difficulty financially supporting the baby. The correct answer is 3. Because antipsychotic agents cross the placental barrier and can be teratogenic, they are to be avoided during pregnancy, especially during the first trimester. Later in the pregnancy, low doses of medications may be given if necessary. Although the degree of excitement by the father, the mother's ability to provide help, and the client's financial situation may or may not be a concern. The priority in this situation is the safety of the fetus and risks associated with the need for antipsychotic therapy. A prima gravida client with class 2 heart disease who is visiting the clinic at 8 weeks gestation tells the nurse that she has been maintaining a low-sodium, 1,800 calories diet. Which of the following instructions should the nurse give the client? 1. Avoid folic acid supplements to prevent megaloblastic anemia. 2. Severely restrict sodium intake throughout the pregnancy. 3. Take iron supplements with milk to enhance absorption. 4. Increase caloric intake to 2,200 calories daily to promote fetal growth. The correct answer is 4. The client can continue a low-sodium diet but should increase the caloric intake to 2,200 calories daily to provide adequate nutrients to support fetal growth and development. Folic acid supplements, a standard component of care, are used to prevent folic acid deficiency, which is associated with megaloblastic anemia during pregnancy. Severe restriction of sodium intake is not recommended because sodium is necessary to maintain fluid volume. Iron supplements should be taken with acidic foods and fluids for maximum absorption. Milk decreases the absorption of iron. An elderly client was prescribed Ativan 1 milligram 3 times a day to help calm her anxiety after her husband's death. The next day, the client calls her daughter asking when she is picking her up to go to the graveside. The client says she has been walking up and down the driveway for the past hour, waiting for her daughter. Noting the client's agitation, hyperactivity, and insistence, the daughter calls the nurse to report her mother's behavior. Which of the following would the nurse suspect is the cause of the mother's behavior? And what action would she suggest? 1. The client is manic and may need a sleeping pill. 2. The client is experiencing a medication interaction and should go to the emergency department. 3. The client is experiencing a paradoxical reaction to Ativan and should stop the new medication immediately. 4. The client is overcome by grief and probably needs an antidepressant. The correct answer is 3. Paradoxical responses to benzodiazepines are more common in children and the elderly than other age groups and generally occur at the beginning of treatment. Grief/depression in the elderly is more likely to result in fatigue and withdrawal and hyperactivity and agitation. Treatment with a sleeping medication, chemically related to benzodiazepines, is likely to result in an increase rather than decrease in agitation symptoms in elderly clients. A medication interaction is possible, but less likely since most pharmacies screen for drug interactions when filling prescriptions. During a home visit, the nurse discovers that the client is less verbal, less active, less responsive to directions, severely anxious, and more stuporous. The nurse interprets these findings to indicate that the client needs which of the following? 1. A sleep aid. 2. A clinic appointment. 3. An increase in medication. 4. Immediate medical evaluation. The correct answer is 4. The client is exhibiting symptoms of becoming catatonic and unable to care for himself, and needs immediate evaluation and possible hospitalization. A sleep aid is not sufficient to treat this client. The client's worsening condition dictates action without waiting for a clinic appointment. An increase in medication may be indicated, but hospitalization is required first for safety. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When developing a teaching plan for a prima gravida client with insulin-dependent diabetes about monitoring blood glucose control and insulin dosages at home, which of the following would the nurse expect to include as a desired target range for blood glucose levels? 1. 40 to 60 milligrams per deciliter between 2 o'clock and 4 p.m. 2. 70 to 100 milligrams per deciliter before meals and bedtime snacks. 3. 110 to 140 milligrams per deciliter before meals and bedtime snacks. 4. 140 to 160 milligrams per deciliter 1 hour after meals. The correct answer is 2. The goal is to maintain blood plasma glucose levels at 70 to 100 milligrams per deciliter before meals and bedtime snacks. Below 60 milligrams per deciliter indicates hypoglycemia. A range of 110 to 140 milligrams per deciliter suggests hyperglycemia. The target range 1 hour after meals is 100 to 120 milligrams per deciliter. A prima gravida client in active labor has had no anesthesia. The client's cervix is 7 centimeters dilated, and she is starting to feel considerable discomfort during contractions. The nurse should instruct the client to change from slow chest breathing to which of the following? 1. Rapid, shallow chest breathing. 2. Deep chest breathing. 3. Rapid pant-blow breathing. 4. Slow abdominal breathing. The correct answer is 1. The psychoprophylaxis method of childbirth suggests using slow chest breathing until it becomes ineffective during labor contractions, then switching to shallow chest breathing, mostly at the sternum, during the peak of a contraction. The rate is 50 to 70 breaths per minute. Deep chest breathing is appropriate for the early phase of labor, in which the client exhibits less frequent contractions. When transition nears, a rapid pant-blow pattern of breathing is used. Slow abdominal breathing is very difficult for clients in labor. A client with undifferentiated schizophrenia tells a nurse that he doesn't go out much because he doesn't have anywhere to go and he doesn't know anyone in the apartment where he's staying. Which of the following actions is most beneficial for the client at this time? 1. Encouraging him to call his family, to visit more often. 2. Making an appointment for the client to see the nurse daily for 2 weeks. 3. Thinking about the need for rehospitalization for the client. 4. Arranging for the client to attend day treatment at the clinic. The correct answer is 4. Because the client can live in an apartment setting, further development of independent functioning and the skills to gain as much independence as he is capable of need to be fostered, including getting out and developing new friendships. Arranging for participation in day treatment is most beneficial at this time. Family visits and daily nursing visits do not encourage the client to do this. Making an appointment for 2 weeks later puts the client's needs off. Lack of social relationships is not a sufficient reason for rehospitalization. A prima gravida client at 30 weeks gestation has been admitted to the hospital with premature rupture of the membranes without contractions. Her cervix is 2 centimeters dilated and 50% effaced. The nurse should next assess the clients. 1. Red blood cell count. 2. Degree of discomfort. 3. Urinary output. 4. Temperature. The correct answer is 4. Premature rupture of the membranes is commonly associated with chorioamnionitis or an infection. A priority assessment for the nurse to make is to document the client's temperature every 2 to 4 hours. Temperature elevation may indicate an infection. Lethargy and an elevated white blood cell count also indicate an infection. The red blood cell count would provide information related to anemia, not infection. The client is not in labor. Therefore, assessing the degree of discomfort is not a priority at this time. Urinary output is not a reliable indicator of an infection, such as chorioamnionitis. A 19-year-old prima gravida client at 38 weeks gestation is 7 centimeters dilated and the presenting part is at +1 station. The client tells a nurse, "I need to push." Which of the following would the nurse do next? 1. Use a McDonald procedure to widen the pelvic opening. 2. Increase the rate of oxygen and intravenous fluids. 3. Instruct the client to use a pant blow pattern of breathing. 4. Tell the client to push only when absolutely necessary. The correct answer is 3. Pushing during the first stage of labor, when the urge is felt but the cervix is not completely dilated, may produce cervical swelling, making labor more difficult. The client should be encouraged to use a pant blow pattern of breathing to help overcome the urge to push. The McDonald procedure is used for cervical circlage for an incompetent cervix and is inappropriate here. Increasing the rate of oxygen and intravenous fluids will not alleviate the pressure that the client is feeling. The client should not push even if she feels the urge to do so, because this may result in cervical edema at 7 centimeters dilation. Several pregnant clients are waiting to be seen in the triage area of the obstetrical unit. Which client should the nurse see first? 1. A client at 13 weeks gestation experiencing nausea and vomiting 3 times a day with +1 ketones in her urine. 2. A client at 37 weeks gestation who is an insulin-dependent diabetic and experiencing 3 to 4 fetal movements per day. 3. A client at 32 weeks gestation who has preeclampsia and +3 proteinuria who is returning for evaluation of epigastric pain. 4. A client at 17 weeks gestation who is not feeling fetal movement at this point in her pregnancy. The correct answer is 3. A preeclamptic client with +3 proteinuria and epigastric pain is at risk for seizing, which would jeopardize the mother and the fetus. Thus, this client would be the highest priority. The client at 13 weeks gestation with nausea and vomiting is a concern because the presence of ketones indicates that her body does not have glucose to break down. However, this situation is a lower priority than the preeclamptic client or the insulin-dependent diabetic. The insulin-dependent diabetic is a high priority. However, fetal movement indicates that the fetus is alive but may be ill. As few as 4 fetal movements in 12 hours can be considered normal. The client may need additional testing to further evaluate fetal well-being. The client who is at 17 weeks gestation may be too early in her pregnancy to experience fetal movement and would be the last person to be seen. Because of the risks associated with administration of factor VIII concentrate, the nurse should teach the child's family to recognize and report which of the following? 1. Yellowing of the skin. 2. Constipation. 3. Abdominal distension. 4. Puffiness around the eyes. The correct answer is 1. Because factor VIII concentrate is derived from large pools of human plasma, the risk of hepatitis is always present. Clinical manifestations of hepatitis include yellowing of the skin, mucous membranes, and sclera. Use of factor VIII concentrate is not associated with constipation, abdominal distension, or puffiness around the eyes. A 21-year-old prima gravida client at 40 weeks gestation is admitted to the hospital in active labor. The client's cervix is 8 centimeters and completely effaced at 0 station. During the transition phase of labor, which of the following is a priority nursing problem? 1. Urinary retention. 2. Hyperventilation. 3. Ineffective coping. 4. Pain. The correct answer is 4. During transition, contractions are increasing in frequency, duration, and intensity. The most appropriate nursing problem is pain related to strength and duration of the contractions. Insufficient information is provided in the scenario to support the other listed nursing diagnoses. Urinary retention would be appropriate if the client had a full bladder and was unable to void. Hyperventilation might apply if client was breathing too rapidly, but there is no evidence this is occurring. Ineffective coping might apply if the client said, "I can't do this," or something similar. After suction and evacuation of a complete hydatidiform mole, the 28-year-old multigravida client asked the nurse when she can become pregnant again. The nurse would advise the client not to become pregnant again for at least which of the following time spans? 1. 6 months. 2. 12 months. 3. 18 months. 4. 24 months. The correct answer is 2. A client who has experienced a molar pregnancy is at risk for development of choriocarcinoma and requires close monitoring of human chorionic gonadotropin levels. Pregnancy would interfere with monitoring these levels. High HCG titers are common for up to 7 weeks after the evacuation of the mole, but then these levels gradually begin to decline. Clients should have a pelvic examination and a blood test for HCG titers every month for 6 months, and then every 2 months for 1 year. Gradually declining HCG levels suggest no complications. Increasing levels are indicative of a malignancy and should be treated with methotrexate. If after 1 year the HCG levels are negative, the client is theoretically free of the risk of a malignancy developing and could plan another pregnancy. The nurse is teaching the parents of a child with sickle cell disease. To instruct them on how to prevent sickle cell crisis, she should include which instruction? 1. Restrict the child's fluid intake to less than 1 quart per day. 2. Drink at least 2 quarts of fluids per day. 3. Stay away from other teenagers. 4. Avoid physical activity. The correct answer is 2. Increasing fluid intake and being well hydrated will help prevent cell stasis in the small vessels. Restricting fluids causes stasis of red blood cells and promotes obstruction and increases the chance of sickling with hypoxia and pain to the part that is involved. Clients with sickle cell disease should stay away from others who have infections. When the spleen of a client who has sickle cell disease has become fibrotic and non-functional, the client is more susceptible to infections. Clients with sickle cell disease should not avoid physical activity as long as the client stays well hydrated. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A multigravida client thought to be at 14 weeks gestation reports that she is experiencing such severe morning sickness that she has not been able to keep anything down for a week. The nurse should assess for signs and symptoms of which of the following? 1. Hypercalcemia. 2. Hypobilirubinemia. 3. Hypokalemia. 4. Hyperglycemia. The correct answer is 3. Gastrointestinal secretion losses from excessive vomiting, diarrhea, and excessive perspiration can result in hypokalemia, hyponatremia, decreased chloride levels, metabolic alkalosis, and eventual acidosis if precautionary measures are not taken. Ketones may be present in the urine. Dehydration can lead to poor maternal and fetal outcomes. Persistent vomiting can lead to hypocalcemia, not hypercalcemia. Hyperbilirubinemia, not hypobilirubinemia, is typical in clients with hyperemesis. Persistent vomiting may affect liver function and subsequently the excretion of bilirubin from the body. Hypoglycemia, not hyperglycemia, may occur as a result of decreased intake of food and fluids, decreased metabolism of nutrients, and excessive vomiting. An infant has been transferred from the ICU to the pediatric floor after undergoing surgery to correct a heart defect. Which tasks can the charge nurse delegate to the licensed practical nurse? Select all that apply. 1. Administering oral medications. 2. Administering IV morphine. 3. Obtaining vital signs. 4. Morning hygiene. 5. Circulation checks. 6. Discharge teaching. The correct answers are 1, 3, and 4. The RN scope of practice includes assessment, planning, implementing, and evaluation. Only aspects of care implementation may be delegated to the LPN, and the exact skills that may be delegated vary by state and institution. In general, LPNs have been trained to perform the tasks of administering oral medications, performing hygiene, and recording the intake and output. LPNs may also take vital signs to gather data, but the RN must interpret the data. Administering IV morphine requires assessment of the client's respiratory status before, during, and after procedure. It should be done by the RN. Circulation checks are assessments the RN should complete. After doing well for a period of time, a child with leukemia develops an overwhelming infection. The child's death is imminent. Which of the following statements offers the nurse the best guide in making plans to assist the parents in dealing with their child's imminent death? 1. Knowing that the prognosis is poor helps prepare relatives for the death of children. 2. Relatives are especially grieved when a child does well at first, but then declines rapidly. 3. Trust in healthcare personnel is most often destroyed by a death that is considered untimely. 4. It is more difficult for relatives to accept the death of an older child than that of a toddler. The correct answer is 2. It has been found that parents are more grieved when optimism is followed by defeat. The nurse should recognize this when planning various ways to help the parents of a dying child. It is not necessarily true that knowing about a poor prognosis for years helps prepare parents for a child's death. Death is still a shock when it occurs. Trust in healthcare personnel is not necessarily destroyed when a death is untimely if the family views the personnel as having done all that was possible. It is not more difficult for parents to accept the death of an older child than that of a younger child. Which of the following statements should the nurse use to describe to the parents why their child with leukemia is at risk for infections? 1. Play activities are too strenuous. 2. Vitamin C intake is reduced over a period of time. 3. The number of red blood cells is inadequate for carrying oxygen. 4. Immature white blood cells are incapable of handling an infectious process. The correct answer is 4. In leukemia, the number of normal white blood cells that are capable of fighting an infection is decreased. Although there is an increased number of immature white blood cells, they are unable to combat infection. Therefore, a child with leukemia is subject to infection. The major morbidity and mortality factor associated with leukemia is infection resulting from the presence of granulocytopenia. While increased activity may cause fatigue, it does not put the child at risk for infection. Vitamin C intake should not decrease if the child has adequate dietary intake. Decreased red blood cells are not directly caused by infection. When assessing a client with chest trauma, the nurse notes that the client is taking small breaths at first, then bigger breaths, then a couple of small breaths, then 10 to 20 seconds of no breaths. The nurse should chart the breathing pattern as 1. Cheyne-Stokes respiration. 2. Hyperventilation. 3. Obstructive sleep apnea. 4. Beale's respiration. The correct answer is 1. Cheyne-Stokes respiration is defined as a regular cycle that starts with normal breaths, which increase and then decrease followed by a period of apnea. It can be related to heart failure or a dysfunction of the respiratory center of the brain. Hyperventilation is the increased rate and depth of respirations. Obstructive sleep apnea is recurring episodes of upper airway obstruction and reduced ventilation. Beale's respiration, also known as cluster breathing, is periods of normal respirations followed by varying periods of apnea. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.